Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned, not-for-profit hospital. Our program focuses on healthcare issues relevant to you and your family. I hope you'll stay tuned because I've got a great guest on the program today. We'll be back right after these messages. Welcome back to Your Health Matters. I'm Jamie Taylor, and my guest today is Dr. Jakula Khan. He's the infectious disease specialist here at Kingman Regional Medical Center. And it's great to have you on the show today, Dr. Khan.
Thank you, Jamie, and good morning.
Good morning.
I'd like to say good morning to our all viewers and Kingman people, and good morning and happy holidays.
Great. The holidays, as we know, is also when you probably get almost your busiest, because that's when people are traveling and sharing their germs across the country. Right?
That is very true. This is the time where you get lots of viruses, activities, and one of them more important is the influenza activities are,
right.
At this time.
Well, I know back in October, KRMC had a big campaign to get free flu shots out to the community. I think we did almost 4,000 free flu shots, trying to make sure that everybody got that influenza vaccine. And hopefully that'll help us keep it better under control this year. And it's not too late, right? People can still get a flu shot?
No, it is not too late. And vaccine is the most important thing to prevent and protect from the influenza,
okay.
which can at times be very serious and deadly.
Right, right, especially for the elderly, or if you have lung diseases.
Exactly, younger children,
right.
With lung conditions, COPD, asthmatics, elderly, diabetics,
okay.
all these people are very, very high risk for the complications of influenza.
Right. You know, we're going to watch a video. One of the things that KRMC is really fortunate, we have our relationship with Mayo Clinic, and they provide us a program called Medical Edge. And they have a program that we're going to watch together that talks about the importance of vaccinations. So let's watch that real quick.
Yes.
A top priority this time of year should be getting your flu shot. Vaccines, they've all but wiped out terrible diseases like polio and measles in the U.S. But that success has made many wonder if they should bother to be vaccinated against them anymore. The resounding answer from Mayo Clinic is yes. Dennis Dota tells us why in Medical Edge.
The ability to vaccinate against disease is heralded as one of the greatest medical advances of modern civilization.
Hand washing before surgery and clean water supply, it really ranks right up there.
Dr. Robert Jacobson is medical director of Mayo Clinic's Community Health Immunization Program. He says we may be surprised to learn getting vaccinated is largely voluntary.
There are for civilians no federal or national requirements for vaccination. When you hear about mandates or requirements, you're actually referring to school, daycare, and college rules.
In the U.S., a group of scientists and physicians called the Advisory Committee on Immunization Practices recommends which vaccines will do us the most good, from infancy through old age.
Now, what's on that list? We have measles, mumps, and rubella, of course, diphtheria, tetanus, and pertussis, flu vaccine, pneumococcal conjugate vaccine, the meningococcal vaccines. We have hepatitis A, hepatitis B.
Dr. Jacobson says while studies have proven there is no link between autism and vaccines, some parents still have concerns.
And that question mark that has been raised has been harmful enough to cause some families to choose not to get vaccinated and have left their children and, frankly, members of their community at risk for measles.
Lax attitudes about getting vaccinated allowed a measles epidemic to explode in France, with 14,000 cases in the first 6 months of this year.
Frankly, across Europe, 33 countries are now suffering outbreaks of measles.
And finally, adults need to stay up to date as well. Only 40% get their recommended flu shot. Chickenpox and mumps can have devastating consequences, and
every adult should have by now received a dose of diphtheria, tetanus, acellular, pertussis.
Yet Dr. Jacobson says only 6% of adults have received that shot.
Dr. Jacobson advises those over age 60 to get a zoster vaccination to protect against shingles, and those over 65 to ask their doctor about a pneumonia vaccination. And anyone traveling internationally should check to see if immunizations are required to enter the countries they'll be visiting. In a future Medical Edge, we'll talk about the HPV vaccine to ward off the sexually transmitted virus that causes certain deadly cancers. For Medical Edge, I'm Vivian Williams.
So obviously that's what we were just talking about, how important it is to get your flu shots. And I think there's still people out there maybe that are worried that they can get the flu from the flu shot, but that's not true.
That's not absolutely true. The vaccine which we give does not have a live virus. So there is no way it can cause any flu, any infection, because it's a dead virus, is crushed and caused, we call it an antigen.
Right.
So this is not, there's no way, there's no
It's not
possibility
putting you-
even of getting an infection from the
Okay.
flu vaccine.
Now what I've heard is that sometimes people have already been infected with the flu before they got the flu shot, and then maybe they get the symptoms right afterwards, and so they think, oh, it's the flu shot gave it to me.
Yes, Jamie, that's a possibility. And another possibility, there can be a small subset of people can get a little bit of fever, some little body ache. That can mimic like a flu kind of thing, but which is not really a flu, which could be a small side effect from that injection.
Okay. So besides the vaccine, of course, we also know the importance of washing hands.
It's very, very important to, not to spread it
Right.
because washing hand is one of the most important things. And the sneezing, coughing in a specific fashion under your sleeves is
Doing
very,
the
very
vampire
important
sneeze.
because it does spread by droplets, by
Right.
coughing, and those droplets can land on the doorknobs and tables. So
And then you touch it. and
you
then
touch
you
it.
can-
So hand washing is a very, very important
Okay.
practice to
Okay.
protect.
And what about, I know I see people a lot of times wearing the masks, and I'm not sure ever if they're wearing them because they're sick or if they're trying to protect themselves. Now, if you're not sick, wearing a mask, would that keep you from?
Masks which are not having a much importance in
Okay.
protection or a spread.
Okay.
This is a perception people may have, but really it doesn't have any significant role in protection.
Okay. So bottom line is, like we said, the most important thing to protect yourself is getting the vaccine.
Getting the vaccine and vaccine and vaccine.
Right.
Vaccine is the most important thing
Okay.
which will protect you from this disease. Yes.
And we were talking before the show that so far, knock on wood, that we've had a fairly quiet season so far.
Right. These last 2010 and 11 and this year seems to be a, but we are not yet in the peak season yet.
True.
because
Now,
the
when does that officially start?
peak season is in the January and February. That's
Okay.
when you get the peak, most of the cases.
Uh-huh.
So we are not there yet.
Right.
So this is a good time to, if you're not taking a flu vaccine, go ahead
You
and
can
please
still
take
get
it.
that.
Yes.
And most primary care providers have the vaccine. I mean, it's not like a couple years ago where we didn't have enough.
No, there is no shortage of. We have plenty of vaccines,
Okay,
and
good.
in different forms of vaccine. You have a choice now.
Oh,
That you have a regular flu vaccine, and
Uh-huh.
then you have a double dose, like a high potency. Then there's intradermal, and then nasal. So there are 4 different
oh, I didn't
categories
even know
of
that.
vaccines you
Well,
can
how
get.
would a person decide which one they
it,
need?
It can be because the certain vaccines are designed for certain kind of people.
Okay.
Like say we have a high dose flu vaccine now. This is the newest variety came this year,
Okay.
which can be given to elderly people who may not mount a good response to vaccine, so they get higher dose of the
Oh, okay.
vaccine, so they can be protected better.
Okay, that's good to know. See, I didn't even, I learned something. Every time I do this show, I learn something new myself, so it's good.
Yeah, and there is just to let you know, there is another called intradermal vaccine where we have a small tiny needle. People who are needle phobic, they
Yes,
want to get
yeah.
it. So there is a small tiny needle which doesn't give much pain.
Oh, that's
So
good.
that is those for the people who doesn't like to have a needle.
Sure, right, yeah.
And as you know, there is another one which is an intranasal vaccine,
Mm-hmm.
which is spread into your nose, nostrils,
Uh-huh.
in the spread. That vaccine has a live virus, though.
Okay. And who would normally get that?
Generally, people anywhere between 2 years to 49 years. That's what the recommendations.
Okay.
But people who are asthma, who can get asthma attack with the vaccine, those people should not get it.
Okay.
But this is another option.
Okay. if they really don't like needles.
They don't like needles, yes.
There are people I know that are out there.
Oh,
My
there are-
sons were one
there
of them.
are all
I always
people.
said I never had to worry about them becoming drug addicts because they hated needles and still do. So-
And just to let you one more thing, Jamie, the people who has a severe allergy to chicken
right.
eggs may not take it, but otherwise it's and it's very rare to have a allergy to
Attack,
chicken
okay.
eggs. Otherwise, most of people can take it.
Take it. Okay.
Or
that's
anybody
good to
who
know,
has
too.
a reaction to the vaccine in the past may not take it, but generally speaking, most of the people can take
Can
it.
have it. Okay, good. And it is important, especially like we've talked about during the holiday season. Everyone's traveling, going to visit family and friends, and they're flying or driving. And even if you don't feel sick at the time, you can be on a plane, and of course you've got all those people on that plane with you, and just one person sick on that plane sneezing and coughing, and they're going to share that with everybody on the plane.
Yeah, you're right. And this makes another reason to have it now, because this holiday season is coming and you will be mingling with a lot of people. There will be parties going on, and you'll be
Right.
traveling and airports. So that exposes you to more to the flu, influenza. So in that case, if you are protected,
Then you
can
don't
be
have
safe.
to worry.
Right,
So that's a good
exactly.
thing to know. Well, I know that there's lots of other things that we want to talk about on this program. We're going to take a quick break, and then we'll come back. And I want to learn more about you and your family as well. So we'll be right back after these messages. Stay tuned.